Welcome to today's discussion about an important topic that could have a significant impact on your health and finances as you approach retirement: AARP Medical Supplement Insurance Plans, commonly referred to as Medigap. If you're nearing the age of 65 or already enrolled in Medicare, you might be wondering, why are there still so many out-of-pocket costs? Isn't Medicare supposed to take care of everything? That's a common frustration, and it's one we're going to address today. The problem you didn't know you'd face. Let's say you've worked hard, and now it's time to enjoy your retirement. You finally get on Medicare, thinking you're fully covered, but then reality hits. There are still costs that Medicare doesn't pay for. You're staring down a pile of medical bills for things like copays, co-insurance, and deductibles. Suddenly, healthcare seems a lot more expensive than you planned for. That's a scary situation, right? Imagine this: you've been saving for years, hoping to spend your retirement on vacations, hobbies, or maybe spoiling the grandkids. But unexpected medical expenses start eating into that savings. It's a situation that could put anyone on edge. The gaps in Medicare. Here's the thing about Original Medicare: it covers many healthcare costs, but not everything. Medicare Part A covers hospital stays, and Part B helps with doctor visits and other services, but it's far from comprehensive. Medicare doesn't cover 100% of your healthcare expenses. You're still on the hook for copays, co-insurance, and annual deductibles. And if you need care that's not covered, like vision, dental, or long-term nursing, you'll need to pay out of pocket. Even the everyday stuff, like eyeglasses or hearing aids, can add up quickly. This is where Medigap comes in. Medigap plans, like those offered by AARP in partnership with United Healthcare, are designed to help fill those gaps. They cover a lot of the expenses Medicare doesn't, helping you keep more of your hard-earned savings. Who is AARP? Before we dive deeper into Medigap, let's take a quick look at AARP. AARP, originally known as the American Association of Retired Persons, was founded in 1958 by Ethel Percy Andrus, a retired educator who wanted to help older Americans stay informed, independent, and empowered. AARP is a nonprofit, membership organization dedicated to improving the lives of people over 50. They're not an insurance company, but they've partnered with United Healthcare to offer Medicare supplement plans that help their members save on out-of-pocket medical expenses. So, why is that important? It means AARP is focused on what's best for you. Their goal isn't just to sell you a policy, it's to provide options that can make your retirement more comfortable and secure. The different plans. What are my choices? When it comes to Medigap, you're not stuck with a one-size-fits-all option. In fact, there are several different plans available, and the choices can be a bit overwhelming. Let's break it down. Medigap plans are labeled with letters A, B, C, D, F, G, K, L, M, and N. These aren't just random letters, each one represents a different set of benefits. Think of them like different levels of protection, kind of like choosing between basic, standard, and premium coverage for other types of insurance. What's important to know is that these plans are standardized across most states. That means Plan G in Florida will offer the same benefits as Plan G in California, though the cost can vary depending on your location and the insurance company you choose. Now, if you're wondering, which plan is right for me, it really depends on your specific needs. Some plans cover more than others, but they also come with higher premiums. Here's a quick breakdown of some of the most popular ones. Plan A is the most basic plan, covering things like Medicare Part A co-insurance, hospital costs, and hospice care. Plan F, for those eligible before 2020, is one of the most comprehensive, covering almost all out-of-pocket expenses, including Medicare Part B deductibles. Plan G is similar to Plan F but doesn't cover the Part B deductible, which makes it a little less expensive. Plan N covers many of the same things but requires you to pay a small copay for some doctor visits and emergency room trips. There's something for nearly every budget, and the good news is that all these plans are guaranteed renewable. As long as you pay your premiums, your coverage stays in place, even if your health changes down the road. What's the catch? Okay, you're probably thinking, this sounds great, but what's the downside? It's true, Medigap plans don't cover everything. They typically don't include coverage for things like long-term care, vision, dental, or hearing aids. And while some Medigap plans help cover healthcare expenses when you travel outside the US, it's usually limited. Plus, not all plans are available in every state. If you've been shopping around, you may have noticed that some states only offer a few of the 10 standardized plans. For instance, Massachusetts, Minnesota, and Wisconsin have their own versions of Medigap. One thing to keep in mind, if you became eligible for Medicare after January 1, 2020, you won't be able to buy Plan C or F, which used to cover the Part B deductible. The good news is that there are still plenty of other solid options, like Plan G, which offers very comprehensive coverage. Enrollment when and how? Here's where timing is everything. Your best chance to get a Medigap plan is during your initial Medigap open enrollment period. This window opens the month you turn 65 and are enrolled in Medicare Part B, and it lasts for 6 months. During this period, insurance companies can't deny you coverage or charge you more based on your health. It's essentially a free pass, so it's a good idea to enroll during this time if possible. What happens if you miss that window? You can still apply for a Medigap plan, but insurance companies might use medical underwriting to decide whether to accept you and how much to charge. If you have health issues, you might find it more difficult or more expensive to get coverage later on. So, it's best to act sooner rather than later. Cost: what will it set you back? The cost of AARP's Medigap plans varies depending on where you live and the type of plan you choose. Insurance companies typically use one of 3 pricing methods. 1. Community rated, where everyone pays the same premium, regardless of age. 2. Issue age rated, where your premium is based on your age when you first buy the policy. The younger you are, the less you pay, and your premium doesn't increase as you age. 3. Attained age rated, where your premium is based on your current age, and it goes up as you get older. Let's take an example. A 65-year-old female, non-smoker, living in Pensacola, Florida, might pay between $120 to $150 per month for a basic plan. The cost will depend on the specific plan and the pricing model used by the insurance company. While that might seem like a lot, remember it's an investment in your peace of mind. You're essentially paying to avoid unexpected out-of-pocket expenses that could cost you much more down the road. Is AARP worth it? AARP's Medigap plans have a few unique perks. First, they're available through United Healthcare, which is one of the largest and most trusted health insurance providers in the country. That means you'll have access to a vast network of Medicare-approved doctors and hospitals across the U.S. You won't be restricted to certain providers, so if you move or travel frequently, your coverage goes with you. Another benefit is that AARP membership itself is pretty affordable, $12 for the first year and $16 annually after that. With your membership, you get access to a range of discounts and services beyond Medigap, including travel, shopping, and entertainment discounts. So, even if you are only interested in Medigap for now, your membership could pay off in other ways. Final thoughts: is Medigap right for you? Choosing whether to enroll in a Medigap plan can feel overwhelming, but it boils down to this: do you want to reduce your risk of unexpected medical bills during retirement? If the answer is yes, Medigap might be a smart option. It won't cover everything, but it will help fill many of the gaps left by Medicare, giving you more financial stability. The key is to look at your health needs and your budget, and then weigh your options. Do you travel a lot? Plan G might be a great fit for you. Want to save a little money upfront but still cover major expenses? Maybe Plan N is more your style. The important thing is to plan ahead and make sure you are not caught off guard by medical expenses when you least expect them. So, if you're tired of the guessing game when it comes to your healthcare costs, Medigap could be your safety net. It won't solve every problem, but it's a solid step in making sure your medical bills don't derail your retirement plans. Take some time to explore your options, and remember AARP and United Healthcare are here to help guide you through the process.